This is one of 13 mini lectures in the Know Your Vitamins series. These audio-based presentations let you listen and learn anytime. Each episode covers what a vitamin does, where to find it, and why it matters. Don't forget to grab your free PDF fact sheet, link in the pinned comments. Let's begin. Let's talk about vitamin D, often called the sunshine vitamin. Unlike most vitamins, your body can produce vitamin D naturally when your skin is exposed to sunlight. But despite this, vitamin D deficiency is incredibly common, affecting millions of people worldwide. So, what does vitamin D actually do? Why is it so important? And how can you make sure you're getting enough? Let's break it down. What vitamin D does. Vitamin D plays a huge role in your health, affecting everything from bone strength to immune function and even your mood. Here are the key functions of vitamin D. Strengthens bones and teeth. Vitamin D helps your body absorb calcium and phosphorus, the two minerals essential for strong bones and teeth. Without enough vitamin D, bones become weak, increasing the risk of osteoporosis and fractures. Boosts the immune system. It enhances your body's ability to fight off infections, colds, and even autoimmune diseases. Supports muscle function. Low vitamin D levels are linked to muscle weakness, making injuries and falls more likely. Regulates mood and mental health. Vitamin D helps with dopamine and serotonin production, which are key for mood stability. Deficiency is linked to depression and anxiety. Reduces inflammation. Chronic inflammation is linked to many diseases, including heart disease, diabetes, and cancer. Vitamin D helps reduce excessive inflammation. Supports heart health. Studies show that people with adequate vitamin D levels have a lower risk of high blood pressure and heart disease. Without enough vitamin D, you might experience fatigue, bone pain, muscle weakness, frequent illness, and depression. In severe cases, it can lead to rickets in children and osteomalacia in adults, both of which cause weak and brittle bones. How your body produces and absorbs vitamin D. Your body can make vitamin D naturally when your skin is exposed to UVB sunlight. The process happens in the skin and then goes through the liver and kidneys to be activated for use. However, many factors affect vitamin D production. Skin color. Darker skin has more melanin, which reduces vitamin D production. Age. Older adults produce less vitamin D. Sun exposure. If you spend most of your time indoors or wear sunscreen constantly, you might not be making enough. Geography. People living in northern countries with long winters get less sunlight and often need supplements. Obesity. Vitamin D is fat-soluble, meaning it gets stored in fat cells, making it harder to use in overweight individuals. Since most people don't get enough sunlight year-round, dietary sources and supplements become essential. Daily values and how to get enough vitamin D. How much vitamin D do you need? Adults, 19 to 70 years, 600 IU, 15 micrograms per day. Seniors, 71 plus years, 800 IU, 20 micrograms per day. Children, 1 to 18 years, 600 IU, 15 micrograms per day. Infants, 0 to 12 months, 400 IU, 10 micrograms per day. Many experts argue these numbers are too low, especially for people who get little sun exposure. Some researchers suggest 1,000 to 2,000 IU per day is more optimal. Foods rich in vitamin D. Vitamin D is hard to get from food alone, but some natural sources include fatty fish per 100 grams, cod liver oil 10,000 IU, salmon 570 IU, mackerel 360 IU, sardines 270 IU, and tuna 268 IU. Dairy and eggs. Egg yolks 37 IU per yolk, cheese 12 IU per 100 grams, and fortified milk 100 IU per cup. Mushrooms. Wild mushrooms 400 IU per 100 grams. Store-bought mushrooms have less, but if you expose them to sunlight before eating, they naturally increase their vitamin D content. Many foods are also fortified with vitamin D, such as cereals, orange juice, and plant-based milks. Vitamins that help vitamin D work better. Vitamin K2 helps direct calcium to your bones and away from arteries, preventing calcification. Found in fermented foods, egg yolks, and butter. Vitamin A works with vitamin D to regulate calcium. Found in liver, carrots, and dairy. Minerals that support vitamin D. Calcium. Vitamin D increases calcium absorption, but you still need enough calcium-rich foods like dairy, leafy greens, and almonds. Magnesium. Helps activate vitamin D. Found in nuts, seeds, whole grains, and dark chocolate. Sunlight versus supplements. Sunlight is the best source of vitamin D, but most people don't get enough year-round. Here's how to optimize your levels. Spend 10 to 30 minutes in the sun daily, depending on skin type and location. Expose large areas of skin, face, and hands aren't enough. Try to get sunlight on your arms, legs, or back. Avoid sunburn. Too much sun increases skin cancer risk, so balance exposure with safety. If you don't get enough sun or food sources, vitamin D supplements are a good option. Vitamin D3, cholecalciferol, is the best form, as it's more effective than D2, ergocalciferol. So, let's recap. Vitamin D is essential for bone health, immunity, muscle function, and heart health. Your body can produce it from sunlight, but many people don't get enough. The best food sources are fatty fish, egg yolks, mushrooms, and fortified foods. It works best with vitamin K2, calcium, and magnesium. If you don't get enough sun, supplements may be necessary. By balancing sunlight exposure, eating vitamin D-rich foods, and considering supplements when needed, you can maintain strong bones, a healthy immune system, and better overall health. Thanks for listening, stay healthy and get some sun.